human, we are born with empathy, but then a lot of times we don't show in the real situation that there is a need. But we are not. We are probably isolated still because of the technology, because nobody talks. I think she said today's generation, be it teenagers to or even somebody who's in a relationship or getting into in their 20s, and there's a question asking, what is the one important skill they have to learn? And she said communication skills.
No, that's something that I am facing day in and day out. And we like want to know how to communicate with these adolescents who are troubled in their mind, especially they have a suicidal risk and things like that. And we don't get any verbal answers. There's hardly any eye contact and there's just a shrug for every question. So it's very difficult.
And I think my question is also on the doctors, right? Like, because of this, the current generation coming with all these available tools too is also a stressful situation. You see that is impacting in terms of the practice, because you said one is to process the communication skills or manage their emotions, but beyond that, this is also like an impact you see in this, or that's helping.
No, I'm actually very jealous of the new gen doctors because
in India, what going to take up the careers and probably in the field of simulation. What is your message? How do you think they should start, or what is this? What is the process for it? Again, this question is, if you had the power to build the ultimate AI simulation lab, what's the first feature you would add? I had this question. I just noted. being for a while, interesting to know that there is this side of the impact. And do you think the over usage of technology or even information available freely, like a Google Doctor, so like that is also impacting?
If you liked this conversation, please hit the like and subscribe button to get the latest updates from my channel, caffeloguewithNaga. If you made it this far, you're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we live. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going strong. Thank you.
So I'm moving away from the simulation topic to more of a pediatric emergency, focusing on that. While it's part of, as you said, simulation is big. It has to be part of that, because to handle. But other than that, like, what is the systemic gaps you are seeing in terms of emergency preparedness in India, or do you think we are definitely marching ahead? Because I know I wanted to hear it from you, because while I have my own understanding of comparison between different countries, be it Europe or versus India, or companies like developed countries like countries like US, or even the developing, be it in Africa. But I want you probably seeing it for the last 20 years or so. Maybe share that, and you've also looked at in London, in UK.
So, the first big challenge is how do you define what's an emergency? Okay. What you perceive as an emergency as a parent versus what the doctor who is trained to perceive as an emergency, that is the biggest gap. Okay. We have certain systems of, prioritizing whom to treat first when there is an emergency. And there are certain set guidelines. Okay. So, for example, in my hospital, we have put guidelines. It's called triage. Okay, so you need to know, if you come with these symptoms, you will be seen within the first 10 minutes, or you will be seen immediately, or you'll be seen within 30 minutes. And that's our threshold in India. Whereas if you are in the UK, that threshold is like in hours together, because of just the sheer numbers that you see. Okay, but there's a lot of, there. I have been in the UK where I've been on the receiving end and on the providing end, and I have seen that, and I've been to the US as well, so I understand what the triad systems are and how they work. However, when a parent sees an emergency, and that's where the real gap is, although we have like put in strong bold letters, still when a parent in India comes, it may be just a fever, it may be anything, for them, their child, and them perceiving as emergency is the emergency. That's the biggest challenge in India, system wise. Okay. The good thing about India is you have specialists available round the clock. You just have to choose the place to go. You will have the care given. There are, but having said that, not all are equipped to handle pediatric emergencies. So you need to be in a children's hospital to get the best care. That's a basic requirement. There are many times where people do not recognize what, the resources or the infrastructure to decide where I need to go. So if you're a parent and you're watching this, I would urge you to find out where is your nearest pediatric emergency if you're a parent,
Yeah.
so that you know where you need to go to.
Yeah.
Find out what their ambulance numbers are, or if there is any such facility available, and keep them in your, stick it on your fridge so that you know, or keep it in your favorites, because you need to know how to approach them. If you do go to a pediatric emergency, do look out for the triage guidelines, and you'll know the doctors and nurses have a system to recognize what's an emergency and how to handle it immediately. And do not take your very fitting child to a clinic, to a doctor. Just going to the doctor is not enough. The doctor should be in the right space to have it. You cannot take an emergency to a clinic,
Yep.
which happens. You have an accident on the street and you just run to the nearest clinic. So just the perception of emergency and the space where you go to are the key system changes that you have. Across the globe, pretty much there are standard guidelines. Pediatric emergency over the last couple of decades has evolved very beautifully across the globe, and there are set protocols, very defined pathways, and people know how to handle it. There are emergency trained nurses and doctors, and there's a and we just need, if you're a parent, you just need to know where these places are and recognize what's an emergency, and to have the faith in the system. Do not go to a wrong infrastructure or a wrong person and then think that we were not handled properly, or delay things. Those are like a couple of system changes. I'm not sure whether that answers your question.
Yes, I think pretty much. I think, I mean, in general, the perception is right, because definitely India has better emergency care and infrastructure. I would say, at least from an attention standpoint, I think you have options to choose from, and it's not like. But if you go to places where there is public health systems, you will have to, as you rightly said, you can't just fabricate the emergency, and then maybe it's an emergency for you because you feel that your child has to be attended, but maybe it's not qualified as an emergency from a medical term, or probably the hospital triaging system, as you say. So then you need to have that understanding, correct? It's very common, and if you places like Canada, or even where UK, or even the other places where there are public, like Nordics, you have to wait, and they also will triage only the very critical in terms of emergency, and it's not like everybody is attended at the same time. I mean, compared to that, India is like in a far better place to be.
No, I just have a feeling that parents think that if I pay money,
Yeah.
I'll be seen first, and that concept has to be really dispelled. And I do want your help to
Definitely. No, that's
get
true.
that message.
Yeah. No, not everything you can buy with money, and it's important to know that, yes, of course, the number of people available to actually handle patients is also the same. You can't just change drastically when you get into a hospital at that point in time who is available, and there is how many patients are available. It is important as a responsible human being to even understand that. So that kind of empathy everybody should have when they go into the hospital. I understand probably it is important, but again, it's more of a trade-off to see how long you can wait versus how
Correct. Yeah. I think hospitals have a safe system that way.
Mm.
Most of the hospitals have a safe system. Okay. They have a process for triaging. There's always one nurse dedicated who does only triaging. So they prioritize who needs to be attended as soon as. Okay. They check the vitals. So they check the pulse, blood pressure, the way the child looks, everything as a priority. Okay. And most of the nurses in almost all the pediatric emergency care, wherever it is, they know how to prioritize, and that is a basic training. Like, for example, like, it's as basic as you put a board to say it's a hospital. It's as basic as that.
Mm.
Okay. So that's something that people need to be trust that system. That's where they are. Okay. They always have a choice to go. And the wait is never like 4 hours, like what happens in the UK. Definitely not. We used to have like, oh, it's a breach only if it is more than 4 hours. And I used to think, oh, okay. When I come to India, it's like it happens like instantly.
Yeah,
So people in India are very lucky for healthcare, but they just need to
true.
be availing the right space. But this may not happen in the public healthcare, but private healthcare is there. The best way to know is, you have an adult emergency, you cannot go to a pediatric hospital. Okay, you cannot go to a clinic. You have a heart attack, you cannot go to a clinic. You need to call the ambulance and go to the right place, which has got the cardiologist there, or like, the emergency care there, the intensive care there. So it's very important to like figure out, So for example, it is like saying that, I want to eat Thai food, then I need to know where the Thai restaurants are. Or I want to eat a vegetarian food, then I need to select the right vegetarian options around me. Like it's as basic as that. People need to know for which emergencies where they need to go and be familiar with their surroundings. They need to have that situational awareness.
True.
When we move to a new place, we just figure out, which restaurant is nearby or who are the movers and packers and all of that. Where's the nearest school? And this also is equally important.
Good. I think it's you covered. I mean, probably from an education. I think we touched about the need for education in terms of what is emergency, and also the gap in general in terms how in the emergency or the pediatric emergencies in India. But I think pretty much mostly I've not seen much of a struggle in terms of getting the right care if there is a real need, right? So at least most of the time, any big or small hospitals or even government is able to handle neonatal as well as the pediatrics, so which is a very good compared to how it was 15 years back to now.
Absolutely. What we probably could structure a little bit more is a 911 system or a 999 system in India. We do have the 108, but they are duty bound to take you only to government hospitals. So, which may have a varied, infrastructure. And so for people seeking, you need to know which is your nearest ambulance service that can take you from home to hospital, and if they do provide such services. So these are like some of the things that you do need to have that situational awareness. That can save you quite a lot of time in
Got
a
it.
crisis.
Okay, so I'm trying to balance the questions or between the pediatric emergency and the simulation so that we try to, I mean, at least I try to understand or bring up a combination of, which is important in both space. So now, I mean, again, going back to the IPSS and the simulation, right? So how do you think if somebody wants to, in India, want to take up the career and probably in the field of simulation, right? And what is your message? How do you think they should start, or what is this? What is the process for that?
So I would say from PediSTARS, we always have a very fixed pathway. So most of them go through 3 levels of mentorship. And when they are through with their level 3, they usually are like, doing some research and they present that to the international globe. And all the IPSS membership for PediSTARS members and from India is free. So we have a lot of resources to reach out to IPSS, and there are fantastic mentors and collaboration that happen, and we're also part of the IPSS now. So both at the admin level and as well as the mentorship level, so there's a research wing called Inspire, which is part of the IPSS. So we're like and there's a good pathway and a connect to most of the young simulationists in India. And that also helps you to reach out, collaborate, conduct more joint research, and like make a change, and grow yourself and your profile as well.
Yeah, that's true. I think I'll put those links in the description when we actually publish this for people to, if they're interested to actually learn simulation as a area of practice for them. Again, the one more point on that trend is I know we talked more on the medical about the medical professional and healthcare professionals in general a lot in terms of handling these situations. But I know from PediSTARS or even IPSS, the involvement of people are not just healthcare professionals. I think there's a lot of common public, who can take up this and trying to help. As you said, there's a lot of people needed to support this initiative to move forward. So I think I want to hear from you on that front. How, as a common public, or even as a young person or a Gen Z who wants to actually contribute to the society, who wants to be part of this, journey, like how do they? Do you think this simulation society is open for it, and how does it? How do they start?
That's a very interesting question, because now, most of the simple simulation is basically learning how to do life support. For
Right.
example, how to do CPR. That is now done by the common public, and intense training, and a lot of people are there to support you to learn how to do CPR. Okay. I am particularly part of the group that is focusing on, like, I did a study on children with trauma who get admitted to PICU. So it's called the TRIP study.
Mm.
And we looked around to see, who are the children, how they're coming, how do they survive, what are the common causes of problems, why do they, not make it. And also, you would be interested to know that, not many are like trained how to handle trauma. Okay. And a key killer is actually bleeding on the streets. Many children don't even have the ability to reach to the ER on
Mm.
in time because they're bled in the streets. There are many adults who are unable to reach to the ER because they bled in the streets. Okay. And nobody was there to handle it. So we have a wonderful program called Active Bleeding Control. Right now, it is in the phase 4 of the study, and this is basically training the common people, like the auto rickshaw drivers, the the policemen, the shopkeepers, where the injuries happen the most in those hot spots. So that was done in Hyderabad in 2017, 18, I think. And then over the years, we've trained even the school students during the COVID time. So we call them ABC gurus. So although children cannot really go and do the active bleeding control by themselves, they know the steps and processes so that they can guide all the common men around them how to actually handle this. And one of the commonest thing is how do you provide the scene safety, how do you call the ambulance, what are the information you need to give, and then how do you make sure that you control the bleed till help arrives. So the tagline is, you are the help till the help arrives.
Yep.
So that part of it is part of the thing that where we are empowering the community to handle these type of challenges. Okay, you might have seen that in the schools, probably in the US, it is very common to see the gunshot injuries and things like that. And so one of the key things is like, how do you control that bleed?
So that bleeding.
Yeah.
I think it's
So
very
that is something we are focusing on.
got it. No, it's very important, right? I think a lot of times it's not just always the doctors are nearby. Again, the first response is somebody who's next to that person who is actually in the street or somewhere there's an accident. So the first response is, at least you should know the basics. I think what I wanted to tell to everybody who's listening, or probably the common public, is that it's not the simulation training what you have. If they go to PediSTARS website and even look at it, or even IPSS for that matter, then not everything is actually requires a medical background and training. These are some life-saving training which anyone as a common public can learn, and try to leverage in the right way if there is a need of emergency before the first line of support comes in, or wait for the ambulance, or you take them to the clinic. I think it's a very good point you talked about bleeding, because it's a very common immediate, I mean, fall, bleeding, those are common emergencies. And
So there are a lot of resources available as well. Like, for example, because I'm a pediatrician and I see the type of emergencies that come through my emergency department. And so we pick up different themes and start training the stakeholders, the key
right.
persons who can make a change. For example, the parents, what do they need to do for common first aids, for simple things like, the child swallowed something that they're not meant to swallow.
Yeah.
or they're choking,
Okay.
or they had some burns, or they touched a hot liquid or something spilt on them, they had a fit at home,
Hmm.
how to handle, or a child fell down, how to recognize what are the red flags, how do we manage this. So that training as well we give through simulation. Okay, we give it to the teachers because that's where the children are most of the time, and so we make sure that the children, the teachers are empowered how to handle each of these. There's a throughput between the hospital emergency department and the schools so that they know how to reach out to provide that help. Many in Bangalore are like working parents, and they can't immediately drop everything and come there, and so we need to empower the school. So we like facilitate video consultations to make sure that that child is safe. And then comes to like the hospital environment. So before the child reaches the hospital, there's a lot of steps. We even train the emergency, the ambulance crew to know how to
Right.
handle these emergencies and transport them safely. So there's a lot of steps there to keep a child safe. So I focus on these type of simulation methods to help the family, to keep the child safe. So before they even come to my hospital,
Correct.
I'd rather them not come, but
No, I think
if
it's
they do come, they come in a way that they're stable.
yeah. I think how do we best prepare everyone to handle such situations? I think it's a very novel, I would say, niche area which you have started, and I think it's good. It's evolving, and I think in the last 10 years, PediSTARS has also grown. I think I would say while we talk about CPR and other things in general, at least CPR has reached to an extent that lot many people know CPR, at least the first response when there is a emergency. At least that awareness is there. While we practice are not as a hesitation, but I think other areas, other different like bleeding and what other different scenarios you can as a common public can help, which is important, not just for medical professionals. So I think it's a commendable job, doctor, in terms of creating such awareness and reaching out and building that as an organization to support. Long way to go, right? As you said.
And I would really be happy when when we have Har Ghar Mein Ek Savior.
Right, that's true.
That's what we are looking at.
Yeah, I think they have this ART team member, right? Usually, in a fire response, every company they will have a person, or at least in every floor, they used to put ART member like that. It's a good way to look at. Yes, you should have. These are very important skills to have. It could save a life. Yeah, why not? So I know we've discussed a lot. I think I want to touch upon definitely AI. Without that, any conversation doesn't end. So I think it's not like I want to forcefully fit in, but I think there is a lot more opportunity for a simulation based place where AI can help. And in the last 3-4 years with ChatGPT and a lot of AI models coming into picture, how do you think AI is challenging the healthcare, and how do you see that is integrated into pediatric simulation? So maybe you want to talk about it, how you're leveraging, or you see that your peers or in the international societies are leveraging, and what is there for the next 5 to 10 years.
If you made it this far, you're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going strong. Thank you.
So that's a that is something that even we medical professionals have dived into, and we also want to be like innovative about AI and integrating that into our care. Clinically, we look up, because that's a ready reckoner. You want a reference for this, or like this one. You just it's available for clinical care. What we try to do is match the real life scenarios which we see in our day to day practice. For example, today I saw a child with wheezing. Okay, I had a parent performing in like like anxious about certain aspects of things, and I would want my team to be trained in such a way that they know how to handle this emergency in a systematic way. I would want to create a sim scenario, and I may not have the time. I've just had enough time to manage clinically, I can just AI it and, just get a sim scenario designed. I can curate it in such a way that, I get different triggers to say, okay, when the oxygen levels drop here, or, I expect you to do these actions. So that's how we design our sim scenario, our curriculum. Okay. So I would like the AI to like be integrated in that. So a lot of people have started doing that. Another interesting thing is like, how do you like get the realism? You have these mannequins.
Right.
Okay. What we tend to do is we use these Bluetooth speakers, and we record certain voices and like certain emotions and the way we give the history, so that we bring life into that mannequin. Okay. So it'll be like, my just so something like that, which we just kind of play it in the Bluetooth speaker. But you could have like an AI that could actually give out the emotions. You could give a script and they could like tell. I had one of my colleagues from Canada who actually just shared with us, like, talk like an Indian mother, talk like a, give the history like, Hispanic. So they have like different methods, and like AI can like simulate a parent and tell us, like, able to give I could like feed in the script and it kind of gives out the voice. What I'm struggling with the AI is basically them not showing the emotions the way that I want an Indian mother to speak. It's very robotic. So I wish that could like change. So in terms of sim curriculum design, in the way we like run the scenarios, and the next thing is like analytics. We need the AI to actually help us. Like, I've done my debriefing. Where are the trigger points? What are the key learning points that we need to touch upon so that these learners are going to improve? I want my team trained in a particular way. Did that match the way how my team performed in simulation? So that analytics, we may want some input there. And then about, our different debriefing methods. So for example, the way you debrief a anxious learner or an emotional participant or a argumentative participant, to just tone the temp and then tone the type of learning points, and then maybe summarize what we learned. So these type of things, AI has been like implemented in different stages. So that's where we are in terms of simulation right now. There's a lot to go. As I told, things are a little bit robotic, and we also need to catch up. Some of us are very traditional, and so we need like us to like mark it up.
Yeah.
We
Yeah.
want to make learning fun, so we create something called escape rooms, or like we gamify the learning.
Right.
So there and all we could utilize the AI. That's where we are in terms of our
I think
simulation
it's
and
more of how do we get more personalized learning
correct.
for each trainee, right? So that's also something which
Yeah.
we can look at.
Yeah.
Again, I listened to this IPSS podcast also where David Rogers has talked specifically on AI and how does it transforming the pediatric simulation, right? So he says that AI as a co-pilot in simulation. Do you see that? Do you also think it would be used in such a way that it can mimic or mirror a mentor or a partner or a lot of trainees who can actually learn, like maybe the gap what we talked about in terms of facilitation could be solved through this.
I think we still have a long way to go. David has done a lot of work on like individual factors of simulation. So most of his work has been like designing a curriculum, based on the learners, what method of debriefing may we use. So it's like an assistant for us. Like, for example, I can just type in and say that I'd like you to create a scenario in this aspect of training my team. And it comes up with a lot of things. So yeah, it acts like your co-pilot,
Pilot.
but still cannot replace you.
But do you think that's not long way? But with the way in which the artificial general intelligence and also AI is developing, maybe that could be an easy way to actually have a robotic AI based enabled with the simulation knowledge, and then it trains. So maybe the gap of training could be solved if they put a lot of research on that as well, right? It's
Absolutely.
testing. Yeah.
I am looking forward to having a co-pilot like that.
Yes. Yeah, I
Certainly.
think we should recommend, I think, to start doing that research and bring something of
Yeah.
it.
Anybody listening to us right now, any volunteers will be happy.
Yeah, true. I
We are
think it's
looking
an
forward to
amazing.
having co-pilots.
Yeah, it's an amazing space to actually, there's a lot of opportunity for AI to play a role. So again, this question is, if you had the power to build the ultimate AI simulation lab, what's the first feature you would add, right? I had this question. I just noted being
I,
in this
I
for a while,
I would love an AI to have a very emotive voice. That's what I want. I
not
would love to have that realism through,
mm,
because most of the AI, when you type a script and say, it can do the accents, but it can't do the emotions. I'm still looking forward to it, like as and when I break the news, I like different emotions to like
mm,
peel up. It gives the script, it reads the script in a different accent, but not the emotion part of it. So that's one thing. And also, like, a easy screen, more like a support, as I said, even for the learners, let it be for the mentors, but more for the learners to be like a co-pilot,
yeah.
hey, you know what, you didn't think about this, what about this, that type of suggestions to say, okay, you designed the scenario like this, but you didn't touch upon this aspect or whatever, so that it acts like a supplement and a co-pilot actually. It also kind of guides you and like gives you the script or what are the equipments you need. Have you kept all of this ready?
Right.
So that kind of reduces, like I spend a lot of time, and probably 10 years ago, we used to spend a lot of time just thinking every single aspect of like, okay, when the participant enters, what am I going to say? How am I going to, make them feel safe? What script do I need to do? How I practice, how I speak up, all of that. So if there is a mirroring and says, it gives like an auto feedback, those
Yeah.
all can reduce, a lot of time. And that can be happening at your own space.
I think it's there already. I think in terms of the Copilot, from a different way of like for example, summarizing an email or meeting notes or like
Correct. Yeah.
recording. So there's a lot of, I think these are easy things to solve if there is definitely a good budget to somebody takes that initiative to put effort on the IT side of the world to help the doctor.
Correct.
Of course, it's a very important space to be. Cool. I think, do you still think? I mean, I think in AI, even though I mean, I think the one question covered a lot. I mean, you have answered the length and breadth in terms of how do you think it's going to help the simulation world. But one question I wanted to ask you is, while there is a lot about AI in general and how it is taking over the world, and there is a lot of jobs going on and things like that. But you still think, from a medical professional and also the healthcare field, it is going to replace that human touch, or do you think how the technology and the human, how do you balance that empathy which the human brings and the technology in the pediatric space or a pediatric training for that matter, right? So I just want to hear your perspective. Do you think is it coming, or do you think no? That's definitely. I don't think it'll never replace an empathy from a human touch.
See, I think it's everything comes with a warning. So for us, actually, you can utilize AI to the best of your abilities. The good way of using AI is to utilize it so that it is your ready reckoner.
Hmm.
Okay, but you need to have a reliable ready reckoner. Okay,
Hmm.
you cannot blindly trust it. Okay, you need to have like some checks and balances. It gives something that so nowadays actually patients are utilizing the AI to like check out their symptoms. So one of the challenges, and in fact it was published as well, that many people in India are using AI and ended up being critically ill
Hmm.
or delayed in like coming to the healthcare setup.
Yeah.
Okay, so it comes with a warning. It's a responsible thing. It's like how you ask the question matters. So same thing holds true even for us. Okay, if we are asking it in a very particular way and you curate it and you personalize it, it works beautifully well. Okay, it gives you certain points, like I may have a very busy shift, but I need to like touch upon some key points. If it gives me a particular way of like doing things, I know I have touched all these points, so then I don't need to worry about. Or like I can look for then the rare cause. Okay, I've done all of this, what next? Okay, so it's a good way of using the AI. I think, I'm not so sure that it will replace a medical professional. It's like how I utilize the AI to the best of it. The empathy part of it, that's something that even we humans need training. So would have my reservations about AI. We're singling AI out for that.
Yeah, that's true. Uh, I think I like your perspective, right? It's not that, as you say, as human, we are born with empathy, but then a lot of times we don't show show that in the real situation, and there is a need. So it's a training, as you say, how do we be more empathetic towards the next person, when you're traveling today with more technology, while we are human beings are supposed to be socially connected, but what we are, at least what I see today, is we are or in a society, but we are not, we are probably isolated still because of the technology, because nobody talks. If you just, I don't know how many times you've noticed, when I go into, let's say I go from here to New York City, so if I hop on a train and then I sit next to the person, then I just see that everybody is like this, or something they're doing in the laptop, so nobody wants to talk. So,
Actually, it's a very interesting thing that you brought out, because one of our child psychologists was telling us that almost many of our adolescents, they just don't know how to express anymore. Okay, they just don't know how to express. And many of the parents now, the smartphones and the devices have become like a nanny that just keeps the patient, their child quiet.
yeah.
Okay, you may use it as a distraction tool, but not as the main, tool. And that's what it has become now. People don't know how to process their emotions, they don't know how to express it well enough, and that's a serious challenge we have. So I wouldn't single out AI at all for empathy. I'd just say that, even we humans need it. We need the training.
No, that's true. I
They
think
have to learn.
it's
And
also a
she
very
said,
valid point you said, right? I
communication
think I
skills.
recently listened to this conversation. I don't know that Esther Perel, who is a well-known psychiatrist and also therapist, but she talks a lot about relationship and communication in terms of how do you handle the mental stress and all that. I think she said today's generation, be it teenagers to, or even somebody who's in a relationship or getting into in their 20s, and there's a question asking, what is the one important skill they have to learn? And she said communication skills. I think it's a mind-blowing answer, because she said everybody's like this. They don't know, as you said, the expression, the how to express things or communicate is lost. I think it's a very valid, where I can resonate when you said, I was listening to that conversation. I just flashed my mind. It's a very valid point you also brought up.
No, that's something that I am facing day in and day out. And we like want to know how to communicate with these adolescents who are troubled in their mind.
Hmm.
Especially they have a suicidal risk and things like that. And we just we don't get any verbal answers. There's hardly any eye contact, and there's just a shrug for every question. So it's very difficult. And like one of my child life specialists who we call, she just told us that they just don't know how to process their emotions, and they don't know how to communicate their emotions, and that's a serious concern. So especially for the psychologists, when they are like talking to figure out what's going on, they need like new skills to like get them out of that.
I think there is. I think I read this book, which is from Dr. M, and it's like, how do you raise mentally strong kids? So I think there's one more interesting perspective. One of the person I talked to, she said, today, how do you have mentally strong parents? Also, something which we need to actually come.
Absolutely. Absolutely. No, more than that, I was like seriously thinking, instead of we need to seriously consider having this parent craft classes. We need to have such workshops.
No, it's very true. I think the problem, I mean, I don't know. Sometimes it's like everybody's running and they're busy. I understand everybody's busy, but to an extent, if you stop and look back, what for you were running, right? I mean, what you've lost in that journey, it's very, very difficult to digest, right? I mean, because the time you spent, the critical time is, I think, the hippocampus, or probably the brain of the child develops till they're 25-year-old. I think it's not fully, means the decision making power slowly it builds. So until then, there is a guidance required. I think it's highly difficult. Then of course, then there's whole growing up, if they're not guided in the right way. You don't have to really think that they will listen to you all the time, but at least the kind of sharing should happen where at least they know that they can talk to their parents whatever it is, at least share that. It's important to have that. I think that's where
So the children also need to feel safe
yes,
communicating with the parents, you see. So that contract should be there in their mind as well.
true.
And that's a big gap. That's a different topic altogether.
No, true. I will focus only on the pediatric and the psychology part of it, maybe in a
Yeah.
different situation for sure. I think love to hear from you. You have a lot of good perspective. I can resonate too, right? Because it's I see that more often. So I think I've covered what I wanted from to bring simulation as a subject to my audience and also to everybody, and why it is important for not just medical professional but also in general for a general common public. Why some of the trainings, life saving skills are very important. While it's very vital from a medical from a doctors or healthcare professionals to be more feel confident and safe when they actually handle the patients, and probably you can try something which is not having a harm. I think I love the way Peter Weinstock mentions. He says he's all the point he mentions is like how do we best prepare busy practitioners for low frequency high risk events, and it's also like far from harming the patients. So the best way to do is to have simulation and train more people that way. You're not doing the real harm, and there's no room for errors. Thanks for sharing those information, right? And lots of the last segment I have is the rapid fire. So I think it's a quick one, so I'll not take more time. It's like if you had to choose, so it'll be a quick answer.
Okay.
I will start with my first question. So coffee or chai during a long hospital shift?
Coffee once a day with my team.
Okay. Simulation, mannequin, or real patient rounds, which stresses you more?
Neither.
I think
Neither.
with this so many years of doing that, now I don't think so it stresses, but probably what is your place which is more comfortable or favorite for you in terms of
Always real patient. Always real patient.
night duty or early morning?
I'm just going to say neither
Yeah.
or either.
Yeah, I think it all depends on the need, right? It's all emergency is like you don't know when it is going to come, so there's nothing like a time boxed.
Always 24/7.
Yes, yeah. I think some of the way in it, I have to look at a lot of people. This is actually I keep repeating about it, right? Maybe I'm a broken record on this one. Like this whole stress situation, and people say that I'm stressed, but when you say 24/7, these are situations where when you go to the hospital, you don't know what kind of situation is you're going to look at. So those are stressful ones, right? I think kudos to all the doctors who are doing that on a day-to-day basis, right? But I think when you see such children comes to your practice and say, they are stressed, or probably they are feeling like that, what do you feel like? Oh, what they have done in their life, or what will be your first thought to get them, or tell the parents, right? I just want to pick your mind on that before we move to the next question.
See, there's something, a very important definition. For example, pain. Okay. Pain definition is pain is what the person perceives or feels. So, like that, stress is what that person feels. That's how it is. You look at Modi ji, he's like, thriving on that.
Yeah.
Okay. So, in
How
our
do you
age,
leverage it for your benefit? Like, how do you
correct.
make it
Yeah.
more
See,
productive?
you enjoy your work, then that's not stress. Stress comes from things that you don't enjoy.
True.
You know,
I mean,
so
again, I don't know whether
your
it
child falling sick is stressful. You got to accept that it's not a pleasant experience. So it is stressful. Let's acknowledge that.
Yeah, but I think you need to have a cope-up mechanism, or able to manage that in a way which doesn't hurt you or stop you from functioning or doing something. That is important. True. Vacation in probably by ocean or mountain, like if you take time out, I hope you would probably do time to refresh yourselves.
So I'm going to say neither because you gave me only two choices.
Okay.
But
So can you please like
I love going to the temples. So
okay,
anybody who
wonderful.
knows me knows that.
Temple, it's one way to get the positive vibes and meditate, or probably
Yeah.
be there. Yeah, that's true.
I just go there to hand over.
If I'm not able to handle something, then at least I'll hand it over to God to see.
Exactly.
Let him drive me forward, right? Yes. Your
I
goal.
had a very sick patient, and I had a Nigerian old grandmother. I was just telling them, okay, your child, this child is very sick. I'm about to like, ventilate this child. But during the process, when I give the medications, your baby doesn't have any reserves. So there's a risk of cardiac arrest. This is something that I had to tell. And then that grandmother just told me, the good Lord is making you do all of this. If he decides that that's what has to happen, I accept it. So he's guiding you. That's what she told me. And that was a very comforting one for me.
Yeah.
So whenever I do anything stressful, I just think about that lady telling me this. So it's that's why there is not much of stress.
No,
But
I
I
think
do hand over to God regularly.
no. I think what she said is very right, coming from the wisdom, right? I think what she has seen. Yeah, I think somebody at that situation talking about that is it shows that power, the maturity and the experience somebody like that brings it.
So for me also, when I look after sick patients, it's a spiritual experience. I always like think through to say, okay, God, give me the strength. Let's see how we can get this family to navigate this stress, this difficult period. How do we navigate this family to like get through this difficult situation? So that's how I focus on.
Got
So
it.
for me, medicine is a spiritual practice.
Yes. No, I think not everybody can survive in the certain areas. Like, for example, handling emergency and that to pediatric, it's not easy. Well,
Right. The
emergency
risk of
itself is not an easy one, but pediatric is even much more, I would say, difficult because of the nature, because the children cannot talk normally, though it's more idiopathic because the doctor needs to identify. It's not like the children can say something about it, right? Because if an adult can actually say, what's going on, it's very, very difficult,
The
you're
risk of burnout is very high amongst pediatric intensivists and emergency doctors across the globe, and the risk of sudden death and all of that is very high amongst them. So it's very important to have a leeway and a let out regularly.
No, that's true. Yeah, I think the emotion, I mean, again, end of day, everybody's human being. So everybody has that, I think the same amount of trauma. I mean, it's not for a family who has a sick child, probably that once they get better, that they're out of that. But for a doctor, it's even on that same day, you might have multiple different
Absolutely.
children, and also
Yes.
the next day said some. So it's the constant battle of, to let it go and do something, because you come back, probably you have your
Yeah.
personal space to actually handle, right? So I know it's like a saint kind of a mind you should have.
It's actually very interesting because, especially when you do newborn intensive care and all that, on one hand, you'll have to congratulate a parent who's just had a baby and look very happy for them. And the next moment you go there and you may be breaking a bad news
Yeah.
to say, sorry, your child is not going to survive in this intensive care. And you got to do it in the same breath, That is really challenging. And you learn with experience how to handle this, the other side of being a doctor. Yeah.
Yes. Yeah, I think many talks about it, right? I think it's important to acknowledge that while it's, I mean, other side is always green, people say, but it is not that. When you actually go through that, it only you will experience. Yeah. You'll go to stress buster again. In the same situation, I wanted to, this question is kind of lands very in the right spot. Your music, books, or anything, you think, what is your stress buster? You said temple, so maybe I can say going to temple would be.
Absolutely. Prayers and temple.
Okay, one skill an young doctor must master. I'm not giving you options now. It's up to you.
Communication.
I know you would say that. Definitely. I think it's an important. They're also part of that generation. So coming up, so maybe it's important to also develop that.
If you want to say like it's the ABC of becoming a doctor, which is like attitude, behavior, and communication.
Okay, got it. Do you see that there is a change in terms of the attitude from the current generation of students? What do you see from how it was like 10, 15 years? Maybe you just want to quickly, I mean, I'm just digressing, but just a question.
Absolutely. As I told you, many of the new generation people who've grown with internet, and those are the young doctors that we are like now beginning to see. And we find that they're very difficult to process their emotions. They just simply don't know how to handle emotions. It may be that, they're not able to acknowledge that, for example, there's a very anxious parent who may say something. A young doctor or a young nurse is unable to handle that. And that's a serious concern. And there's a lot more awareness about work-life balance. So not many are opting to do night shifts. Okay. And it is at And the IT crowd where I practice in, they are free only at the nights. So they come only at the nights. We struggle quite a lot just to get our doctors who are at night to process the emotions and the stress that they come in with. It's a reality. It's a
Yeah.
reality for us. If there's any IT people listening to us, be aware.
Interesting, right? I think do you think there's also the lot of one side the technology is helping. There's a lot available, the infrastructure standpoint or from a knowledge from how it was 20 years back too. So of course there is a pro and an advantage to it, but there is also like what you said. It's very interesting to know that there is this side of the impact. And do you think the over usage of technology or even information available freely, like a Google doctor, so like that is also impacting in terms of taking decisions, or do you see that or no?
The thing is actually,
If you made it this far, you're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we live. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going. Thank you.
so for me in pediatrics, parents come in after, like, for a viral infection, they would have started all sorts of antibiotics and then they come and see me. And I feel like, majority of the times, just give time to your child to heal. That's all you need to do. But, we are in the Blinkit and Zepto zamana now. So, people want instant relief. It's not going to happen. You don't need to pour in multiple medications to your children.
It's going to kill the immune system. The
I
body's
think
natural
it's
fighting
not,
mechanism to
it's not
actually
about immune system. It's about
natural fighting.
nourishing your immune system by like natural defense.
Yeah.
And that opportunity we're not able to give to our children right now.
And I think my question is also on the doctors, right? Like, because of this, the current generation coming with all these available tools too is also a stressful situation. Do you see that is impacting in terms of the practice? Because you said one is to process the communication skills or manage their emotions, but beyond that, this is also like an impact you see in this, or that's helping.
No, I'm actually very jealous of the new gen doctors because, I remember going to the library,
Yeah.
spending middle of the night sitting and reading books,
For specific reference.
to just find out what's the best way to handle or manage a situation. And the young gen have it in their hands, the fingertips. So, no, I don't think it has affected them to that extent. But definitely, this is a generic thing and not specific to doctors. But our young doctors have a different approach. They're very sensitive. It's very difficult to give a feedback. They feel very threatened. And I'm sure that is like general with all the
very true.
all the industries.
This is also one thing that they're very impatient. One thing which I felt, I've seen, like I've been like
They want
getting
instant
people for
success.
last 25 years or so,
Yes.
even in the corporate, like I've seen the generations every time there's a fresher coming. And also there's a difference in the dimensions of people coming from south, north, east. That difference also I've seen. So
Absolutely.
yeah.
We're going through a lot, like every other industry. And in India, right now we are in a situation where the best, you train them, they've left the country. That's a real situation. So, we got to deal with what we have. That's where I am right now,
Okay.
dealing with my juniors. I feel ancient oak tree.
The pediatric emergencies are more about calm under pressure or speed of action, or both.
Okay, so the calm under pressure should be the thought. The action and speed should be in actions. So the
Right.
speed should be in action, and calmness should be in your thoughts.
Yeah, you're calm at mind, but then you're acting at that agility which is required.
Yeah.
Yes. Yeah, it's a very well said. If you had to pick stethoscope, simulation kit, or teamwork, what saves more lives in the long run?
Absolutely, human factors and teamwork. Absolutely.
That's true. More than anything else, it's always a teamwork.
You
Biggest
get
myth
your
about
team right, you save more lives. There's no doubt about that. That's what simulation is all about.
Yes.
Sim and steps
Yes.
is just a secondary tool.
It's a enabler. Biggest myth about pediatrics, if you like to burst in one line or anything you think in general.
I just don't know what the myth about a pediatrician is, but I think that, probably the minute you see the doctor, the illness disappears.
I think
That's
it's
a myth.
not. It's a belief system, I guess. Probably more like a magic wand the doctor has to solve any problem which comes. But as a parent or as an individual, I don't put effort on my body, right? So and then I expect the doctor to solve it. Yeah, that's true.
That is for like the little grown up. What we need to remember is, the youngsters usually have, like the very young children, their issues are with getting to know all the bugs, learning how to defend. Okay, that's a process.
Right.
Okay, we've got like vaccinations that help them in remembering that these are the bugs you need to fight. So it sensitizes the system. So right now we have multiple vaccines that helps, in handling all the major killers that would have probably been there 20, 30 years ago.
Yes.
Okay,
Yes.
we made significant progress there. Okay, but so now we have like certain viruses which don't have the vaccines. You just need to give time for your body to handle it. And so, we are in a hurry throwing in multiple drugs. That's not good. So, be measured in the way you approach. So that the myth is like, that the doctor will prescribe something and that's going to magically vanish my baby's symptoms. That's the myth they have.
Yeah. Okay, if you want to probably ban, or I would say erase one phrase parents say in emergencies, so what would that be?
Yeah, same thing. I am the emergency. My child is having the biggest emergency.
Yes, I think we talked about it. That's true.
Yeah.
Yeah, it's an important to ask yourself that it's a real emergency, or yeah, that's true. I think it's a conscious effort. I think every parent should make, especially in coming to the NICU or the pediatric emergency care. Simulation feels more like a video game rehearsal or a real life. So, what would you associate that to? It's more of a rehearsal,
We,
or
we rehearse real life through simulation.
got it.
Yeah.
Your favorite simulation scenario: airway emergency, trauma, or cardiac arrest? Like,
Actually, trauma, if it is something that I really want to save lives, because that's not an illness. It just
yeah,
is imposed on you. So if we get it right, okay, there's something called platinum minutes and golden hour of managing trauma. So if we can just get it right, we may save more lives.
got it. True. Um, if you could only teach one concept through simulation forever, like what would that be?
I'd still come back to communication. So it's breaking the bad news.
Okay, true. I think I mean now I keep thinking because after you said multiple times, I'm just trying to think is how important is that is to right from a doctor to say that unless you either you're the doctor or you're that family, it's difficult to as a third person to even understand.
It's like, for example, it's like how you approach a child. It's like how you talk to the family, how you make them feel safe. Do you give the space to them to, like, sponge out their emotions? And do you have the ability to handle it? But most importantly, how to keep yourself safe as well. In the current generation, I think we need to think about it. So there's something called crisis resource management that I focus on, and it's all about the principles of CRM that we say. That's something that pilots do regularly. And in our situation also, we do that. So it's called the crisis resource management. And there are like 13 components of it, which we just highlight on. So it can be something like how to call for help,
Right.
to actually how you anticipate, plan, how do you do communication, how do you be proactive, how do you utilize all your resources around you. So these are the simple things, but very important. So if you come to the place where I work, the CRM wheel is always there, staring on your face, to all the doctors that work there, all the nurses that work there.
Yeah.
The first thing that I talk about is just that.
Wow. It's very interesting perspective and also a thoughtful behavioral aspect to look at from a training standpoint. But well, technical skills are always learned at school and given from a formal education. But behavioral aspects like this is very not well talked about from a field where there is a constant communication involved every day.
Correct. Yeah.
Yeah,
This
interesting.
is one field where unless you talk, and the way you talk matters quite a lot. It can
Yeah,
have
profound
a
impact. Yeah.
making or a breaking touch.
Yes, yes. It has a profound and lasting impact, both
Yeah.
sides. What's tougher, designing a simulation or debriefing after it?
Designing a scenario is something that I like more. Debriefing requires, the aptitude to decide how to like communicate. So that comes with it. So we incorporate debriefing in every simulation scenario that we design. So we cannot separate them. It's like asking head or tails. We need both. We need both.
We need both. Yep, that's true. Again, I think one more personal question to ask, right? So if you've not, let's say, if you've not taken a critical care as a practice, then what would be other, I mean, maybe pediatric, but if it's not pediatric and pediatric critical care, then what would be your, which specialty you would have taken, and which was your second favorite, probably from a practice standpoint in the medical profession?
Okay. I'm going to like zoom out. I wouldn't have want to do anything else from medical profession at all, but my
Oh God.
choice was always to become a ISRO scientist.
Oh.
That's what was my dream. So when I was in the PUC, I used to look at all the ISRO buses, and I always used to think that's where I'm going to be in 5 years. But it didn't happen, unfortunately. I
mi-
didn't even want to take the medical entrance exam. Medicine was not my first choice at all.
Oh, okay. We missed a scientist. But yes, I think you are doing a lot of service in this
Yeah,
field.
now I'm blessed. I feel privileged. God had better decisions for
Yes.
me than being an ISRO
Uh,
scientist.
Sometimes things happen for a reason, right? So
Yeah,
that's true.
absolutely. I'm very grateful.
Before my last question, so again from a, so you're, how do you handle? As I mean, this is again as a doctor. I want to just, you have gone through as a woman, you had a career in, and you worked in London, you came back to India, and you continued your passion, and you're a mother. uh, I mean, I just want, I mean, probably want to talk about how you have handled your transition from different places, and also continued your passion and career. Let's say from a women who wants to actually do something for the society and also continue their career. There is a lot of struggle these days, or for whatever reason, right? If they want to come back, so what is your message to, be it a medical professional who wants to who are in the upcoming career, or any women who wants to do something big, or come back after maternity? How, I just want to get your message, or how you have handled, maybe to share that before my last question.
That's a very personal question for me, and I can share my very personal story as well. And I'll just count my blessings. I had wonderful, wonderful in laws. I have had wonderful in laws and very thoughtful. And a very, very supportive husband. So we both, me and my husband, are from the same batch of medicine. So it was very difficult to my husband was trained in India and I trained in the UK. So when I actually so when he joined me and then did that, when I had my baby, I decided automatically that I need to go part time so that I can manage, because we were in the UK.
Hmm.
And when I was just telling that to my father-in-law, he just told me, so you're going to take 10 years to become a consultant, and Raghuram, who came after you, is going to become a consultant within 5 years, and you're okay with that? And I thought, okay, I'm not okay, but what do I have as a choice? And then my father-in-law told, nothing doing. I'm going to send a nanny to you. She's going to take care of all your domestics. You will focus on your career and you will do what you want to do. I think that was very powerful and insightful of my father-in-law. And my mother-in-law is a gynecologist, and my father-in-law is an ENT professor,
Oh,
and they live their lives like that. So I'm very, very blessed. And so it's very important to think through. And even to this day, I never had to think like, am I going to leave my child and go? Even when I put PediSTARS or when I did anything, I went through this cycle of complete support, and I live with my in-laws, so I'm very well supported. So I think for anybody who wants to aspire to do more, it's important to have that symbiotic relationship with families.
yeah, I think thanks for sharing that. I think it's important, right? I think it's uh, but I think a lot of times the support of family, because it's a nuclear family these days, it's difficult to have. So again, it's more of how do you balance that. It's a choice which women have to make. Yeah, thank you for sharing that. I know you have a daughter who is
Yeah, I
also
have a daughter,
that
yeah.
is
Yeah. She's not a doctor. So she She has chosen to be in the economics front. So she
Okay.
studied, she studied BSc Economics. She's in London, and so she's an example for us to say, when I asked her, why did you choose economics and not the medical field, and she told me that, you can touch only one life. I can touch many lives by the way I write the policies.
Yeah.
So it's important to be in that field. And I
Nice.
thought that was very powerful. So
Yeah.
I didn't have any questions to ask.
No, that's true. I think even if you see, it's a very, very powerful thought, right? Because it's Sushma Swaraj, or even, I think one of the women leader who talked about, when they asked why, why it is important to actually become, with all the professions in why did you come into this? They said, not many have an opportunity to change, bring change. But even if you have a thought of bringing change, unless you are part of the policy, you're a policy maker or part of writing the policies, you can't bring change. So you can just try to influence from outside, but unless you are part of that, yeah, it's very good to hear. In one word, simulation is just, that's the last question we'll for ending.
Worth it.
Yes, true, very much. It's definitely worth it. Yeah, more than worth it for sure. I think it's important everybody understands how vital a role it plays in the pediatric and emergency, not just pediatric, but in general from a medical, for to help the healthcare professionals to be more safe and competence. I think I want to end with this quote message from Peter Weinstock. He said, "Unconscious competence is very dangerous, but conscious competence is very important." And I think the simulation is driving that for all the healthcare professionals, right? So which is. I think thank you, Dr. Sujatha, for sharing your wisdom and bringing simulation as a practice in the forefront for India, and trying to do that, continuing to do now as well. So thank you for being on my show, and it's so grateful and wonderful talking to you.
Thank you so much for the opportunity.
All right, thank you, Doctor. Have a good rest of the day, and bye.
Thanks a lot. Thank you.
If you liked this conversation, please hit the like and subscribe button to get the latest updates from my channel, caffeloguewithNaga. If you made it this far, you're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going. Thank you.